Hello, and thank you, Leo, for the introduction. Hello, everyone, and good morning. As I mentioned earlier, my name is Christine Nelson, and I am the co-chair, and Marilyn Zen and I will be discussing our findings from the Food Policy Working Group. Our group specifically focused on issues in farm working housing in San Luis Obispo County. We will be discussing the working group's formation, purpose, the decision-making process, next steps, and overall what we learned throughout this entire process. We hope these findings can be used for future development on this issue and propel new interest in continuing these efforts. The Food Policy Working Group stemmed from the collaborative partnership between the San Luis Obispo County Food System Coalition and Cal Poly, as Cal Poly received funding from the university's Strategic Research Initiative program. In order to identify existing policies, programs, and resources affecting the SLO County food system, the SLO County Food System Coalition hosted a roundtable discussion in February 2021, which focused on four major themes: health, environment, economy, and access and equity. The results of this workshop showed a need for a work group to explore the feasibility of developing a comprehensive food policy for San Luis Obispo County. So in March 2021, we held our first meeting. Our goals were to, one, review existing regional plan policies, guides, and recommended strategies related to food policy. Number two was to build partnerships with local government officials and key stakeholders within the San Luis Obispo County food system. And then lastly, to develop a food policy for San Luis Obispo County to address the needs in the community. Our group met from March 2021 to April 2022 with an emphasis on farm worker housing as our policy issue. In the beginning stages, we focused on defining what could we actually do as a food policy working group in 1 year. To determine this, we explored food policies in other cities and counties throughout the state and discussed current food system related challenges in our local region. These early discussions set the foundation for our work, which included developing a comprehensive food policy for San Luis Obispo County was not feasible within the year timeframe. Major challenges exist in determining at which level a policy would be adopted, and most importantly, how would it be implemented? For example, counties and municipalities have general plans that serve as blueprints for their future development as a community. But throughout our discussions, we noted general plans were not viewed as a useful vehicle to implement policy. So we looked into other comprehensive food action plans developed by California counties such as Santa Barbara and Sonoma. However, themes of sustained funding, action, and accountability were vital in the implementation of these comprehensive food plans, which posed significant challenges for our working group. More specific county or citywide policy actions are more feasible and will have greater impact. These would address specific concerns identified and prioritized by community stakeholders. Third, community and stakeholder support is absolutely critical for these efforts. It's important to note that members of the Food System Coalition represent all sectors of the food system here in San Luis Obispo. Broader partnerships and strong community support can only strengthen the education and advocacy efforts of this coalition. After multiple discussions and input from our community members and stakeholders, the health and equity of the Latinx community and among farm workers became the priority for our work group. From nutrition education, housing, to access to healthcare, these issues were consistently being brought up. It's important to note that nutrition education is the only one directly linked to the idea of food. However, recognizing the importance of farm worker living conditions to the food system, we decided to pursue this issue for further investigation. We utilized the CDC's Center for Disease Control and Prevention process for policy analysis as we conducted an environmental scan, which consisted of identifying local food assistance resources and efforts, housing policies, and sources of healthcare. Researching state and national policies relevant to immigrant farm workers. And lastly, throughout our environmental scan, we were able to identify local individuals and organizations working in these areas. We extended the invitation to individuals who work directly with or on behalf of farm workers for their perspectives on these issues. In August 2021, we narrowed down our focus to housing and access to affordable housing. There were a few reasons why we selected housing. First, we wanted to avoid duplication of efforts in nutrition education and nutrition assistance by others. It was brought to our attention from our community partners that a majority of farm workers in San Luis Obispo County commute from King City, Avenal, or Santa Maria. Also, failure to address the lack of safe and affordable housing for farm workers perpetuates a significant quality of life issue for farm workers. And it also has substantial implications for local businesses that rely on these workers. We also discussed the importance of a needs assessment of farm worker housing and how one currently does not exist in San Luis Obispo County. Lastly, we had multiple community members and stakeholders participate in our monthly meetings, as you can see on the left of this slide. Our working group would not have been able to make such strides if not for these organizations, because each one of these folks brought their expertise and experience to the table, which helped us determine our priority for our working group. And so we just want to extend our gratitude and our thanks for all of these community organizations for their time and energy. I'm now going to pass it along to my colleague, Marilyn, the co-chair, as she will be delving into more of the policy issue and the findings from our working group.
Thank you, Christine. So as Christine mentioned, we decided after a long and thorough process to explore the issue of farm worker housing. And even though it was quite a bit of work to narrow it down to this issue, what we found almost right away is that this is an enormous issue. And this is one of the things that we ended up stumping us, because we looked at it and we thought, what can we do with such a large issue? We did note that there have been things that have passed recently. So as you see in the slide, in SLO County, there were amendments to a SLO County housing ordinance that would streamline the permit process for housing. There was also the recent approval of farm worker housing that would house about up to 240 farm workers in Shandon. Ultimately, we decided that the best thing for us to do would be to actually partner with someone who is really active in the policy area and very familiar with the policy terrain. And so we partnered with Kenneth Triguero, who is the CEO of People's Self-Help Housing. And that's where we had discussions about what is the role of the Food System Coalition. And I guess we had gone into this thinking that we were interested in food system policy overall. And in the end, we realized that probably our best role is education and advocacy. So that would be the next slide. Education in terms of what the community knows or doesn't know about agricultural housing. There have been For example, on the right, you see what happened in Nipomo. So there's this not in my backyard sort of activism where there was farm worker housing that was underway. So development of farm worker housing in Nipomo, and apparent arson put a stop to that project. And it hasn't, as far as I know, been started up again. So actions like that made us realize that this is something that really the Food System Coalition could be involved in educating the community or informing the community about housing conditions, but also the importance of farm worker housing to SLO County, given the importance of farm workers to our economy and to our communities. And with that, also the idea that we could be involved in advocacy, that is, when there are things that might be coming up for approval, that the Food System Coalition could take a more active role in attending meetings and hearings and weighing in on approval or not approval of the various regulations and ordinances, and really trying to become more engaged with the local government. Yeah, thank you, Christine. And I think we had a few take-home messages. So one is that we ultimately decided that our working group should be specific and strategic about the policies being addressed. I mean, we saw how big this issue of farm worker housing is. And although we knew that something had to be done, really the most strategic actions to take would be looking at what seem to be very small steps, but are actually important steps towards the larger issues. And the other thing that we came to realize is that the SLO County Food System Coalition really is an important part of it, because it is a coalition and its membership can be highly influential. So we thought it could be, the power of it could be leveraged for advocacy as well as education, a lot of trusted voices as part of the coalition. We talked about engaging a diverse range across sectors of the SLO County food system. And finally, a message that we thought should come through to everyone is just how important these issues are in terms of our resilience as a community, and that this was something that we thought everybody could join up in. Everyone would be interested in this. So I'm really thrilled to be part of a panel to hear what other people say in related issues to this. Thank you.
Thank you, Marilyn and Christine. And remember, if you do have questions, you'll be able to ask them after these presentations. And up next, we have Andrea Keisler, who's been with the SLO Food Bank for up to 10 years as Community Programs Director, supervising direct services for members, and in relation to CalFresh, the Nutrition Education Program, and the Food Safety Program, and other education programs. And Andrea is going to be sharing about how to reduce health risks by overcoming food system inequities in the food system.
Thank you. And thanks for having me this morning. I am trying to figure out how to read my notes and have you see this in slide format. So bear with me here. I may just have to do it like this. So I wanted to start by giving you a little, well, first of all, I'm going to touch on 3 different parts of this presentation. I'm going to give you a little bit of background on this project. I'm going to show you what we learned, and then briefly go over the recommendations that that resulted from this project. Let's see here. I'm sorry about the visuals. So to give you a little bit of background, and to go back to 2021, just as Christine did at the beginning of her presentation, in the spring of 2021, as we're all aware, the COVID-19 pandemic had already impacted the world and our community for a year, and the Slow Food Bank was one of the essential services responding to this public health emergency. So, within the Slow Food Bank, we were challenged with, and at that point, even in 2021, we were still challenged with some major obstacles to serving those in our community who needed food. The pandemic had rapidly and significantly shifted what we did and how we did it. So by 2021, we had also started to understand the impact of the pandemic on different communities in our society, and had found that those communities most negatively impacted by the pandemic were also most often divided along ethnic, racial, and economic lines. As an example, in SLO County by early 2021, it had been reported that Latino residents in SLO County were suffering from COVID infections at over twice the rate that white residents were. So that spring, the California Department of Public Health awarded us a grant to investigate and address the health disparities that led to this disproportionate negative impact for specific populations within our local communities. The purpose of our effort was to investigate the root causes of nutritional food scarcity and develop recommendations on ways that the food and social service sectors can change policies and procedures to increase food access, resulting in better health and lower COVID-19 risk. The project focused on 4 high-risk priority populations: Latino residents, seniors, the unhoused, and low-income earning persons. I wanted to start with this because Shannon had asked us to kind of connect whatever we were talking about today with the SLO food system. So I wanted to start with that. And so moving into our actual project, we hired a project manager. Her name is Emily Dominguez, and she's on this meeting today. And I just want to give her a shout out and a thank you for all of her work on this project. We welcomed her to our food bank staff in December 2021. Emily partnered also with the Promotores Collaborative to conduct interviews with SLO County residents, agency partner organizations, food bank staff, and other community partners. So in all, over the course of about a year, they completed nearly 350 resident interviews, 21 interviews with agency partners, and 7 food bank staff interviews. And they were also doing this during the Omicron surge and impacted still by COVID to a large extent. And then one other thing about our project manager, Emily, she had kind of a unique perspective as a part-time employee of the SLO Food Bank. Even though she wasn't on site every single day, she did spend time getting to know and talking with our staff, attending staff meetings, food distributions, outreaches, and really used the connection with the SLO Food Bank as a jumping off point to connect with the wider network and to develop creative and strategic methods for reaching out to service providers and residents. Okay, I'm going to move. Let's see here. So the next section is about what we learned through this interview process. There were 3 major themes that emerged from the interviews relating to clients' food choices. That was the first theme. Barriers to access to nutritious food, which is the second theme, and the systems that impact access to nutritious food in San Luis Obispo County. That's the third theme. So we gained insight into the factors motivating residents' food choices, as well as institutional and systemic barriers impacting residents' access to nutritious food. And I would love to go into a lot of detail about what we found, but I'm just going to kind of cover some of the broad strokes in the interest of time. But to give you a sense of some of the detail around theme 1, which was food choices. This theme highlighted the factors and the conditions influencing where and how residents sourced food, as well as what specific food choices were made. So price and nutrition were overwhelmingly found to be primary influencers in food choices for all 4 high-risk priority populations. So residents reported changing their food choices due to rising prices, also adjusting their buying behaviors by selecting stores based on food discounts, coupon use, fuel consumption efficiencies, and doing things like buying less meat and other expensive items. Additionally, residents reported that they were forced to choose between food and other competing survival costs, such as housing, fuel, clothes, and more. So these competing essential expenses were found to be motivating factors for those who utilize the hunger relief services of the SLO Food Bank and our network of nonprofit partners. So in addition to the cost, nutrition I mentioned before was found to be the second most important influence on food choices. Dietary restrictions were mentioned by members of all 4 priority populations as well, although significantly more with seniors and unsheltered residents. They shared that concern more than the other priority groups. Let's see here. Second theme was barriers to access to nutritious food. So within this theme, 4 categories kind of emerged from the interviews. The first category was finances as a barrier. Residents found it difficult to obtain the foods they consume often due to the increasing price of food and cost of living. The second category under this theme that emerged was bureaucracy. So qualifying for and receiving government assistance was found to be a significant barrier for many residents. So for example, many residents reported not qualifying for government services such as CalFresh due to immigration status. Additionally, many residents, particularly seniors and disabled residents, reported their experience of living on the periphery of eligibility for government and community assistance programs, which means they needed assistance, but they may not meet all the eligibility requirements to receive assistance. And then additionally, under this category of bureaucracy, many government and community-based services require lengthy, often confusing intake processes. So this was found to be a significant barrier for non-English speakers and/or residents who need one-time emergency food assistance. Another category that emerged under this theme of barriers was relationships. So overall, interviewees advocated for stronger relationships with the food bank. And so in this category, what we heard was to prevent distortions as information flows through communications channels. Agency partners and service providers requested improving mechanisms for maintaining accurate information about SLO Food Bank programs, services, and schedules. They also, sought improved services for referral to navigation of food and non-food services and programs to augment food distributions in meeting a family's basic needs. Many Latino interviewees expressed a need for improved trust and enhanced relationships with the SLO Food Bank and its partner agencies. They reported distrust and reluctance to access hunger relief services were found to exist in circumstances when Spanish-speaking or culturally familiar staff were not readily available, as well as when agency familiarity was not clearly established. And then the last category that kind of came up through this theme was logistics. So all high-risk priority populations, all 4 populations cited transportation challenges as the primary logistic barrier. And for those without cars, for example, walking or taking the bus was very challenging, and was definitely came through in the data. Okay, last theme, theme number 3 that emerged was hunger relief systems that impact access to nutritious food in San Luis Obispo County. While the SLO Food Bank seeks to maintain strong relationships with its community partners, multiple service providers still share that they have clients who will not attend food bank distributions due to a lack of trust or inaccurate information that's been provided. So additionally, based on feedback from agency partners and service providers, they have a challenge with capacity. So their current organizational capacity limits their abilities to enhance programming with things like multilingual staff and expanded client choice in food offerings. And last, service providers lack access to a repository of contact and service information so that they can provide accurate and updated referrals to clients. So again, they would seek improved interagency communication to ensure that they have the best information for client referrals. So the last section of this presentation is going to cover the recommendations that came forward from the themes that we just covered. Let's see here. So I'm going to go briefly over these. So there were 5 recommendations that came out of this project. And the first one, so they were derived from needs and the service gaps that were expressed in the interview data. They addressed the issues raised in the project and also represent generally accepted best practices in food bank operations and organizational equity practices. So the first recommendation that came forward was around client relations. So the recommendation being develop reciprocal relationships with clients that are rooted in trust. And what that might look like, so some of the suggestions for specific approaches would be establishing a feedback loop to continually engage clients in addressing needs and solutions, assign or create a staff position focused on client relations with the ability to communicate in clients' languages, evaluate including client representation on the board of directors, or better understand clients through basic demographic data collection. The second recommendation involves client choice. And the recommendation would be to evaluate options to expand client choice in our operations. And incorporating client choice into distributions and pantries allows clients to choose the food that meet their needs and preserves the dignity of those accessing hunger services. Additionally, under client choice, a suggestion was improving CalFresh enrollment and utilization as a method of expanding client choice. The third recommendation was systems change. So the recommendation for the SLO Food Bank was recognizing that food insecurity is intimately tied to social and economic factors outside of pure food distribution, including livable wages, local availability of nutritious food, affordable housing, and inclusiveness in community programs. The recommendation was to evaluate SLO Food Bank's role in advocating for economic and food justice in the community and helping empower people to become stable and self-sufficient. Oh, running out of time? Okay. Totally. So two other recommendations. Number 4 was access. So making sure we're addressing logistical barriers like transportation and timing of services. And the 5th one was information sharing. So improve the distribution of timely, accurate hunger relief services information throughout the network and collaborate with other social services agencies. So that kind of concludes our what we found through the project. We're in the middle of, next steps. This actually hasn't been released formally, so you're getting kind of a sneak peek of this information. But the food bank has started a strategic planning process, this is helping inform how we build that out through the next couple of months. So I'll end there. Sorry, I went over.
Thank you so much, Andrea. And our next speaker will be Zulema Aleman. Zulema is the Associate Director at CAUSE, and CAUSE is an organization that develops the people's power in the coastal Central Coast. She began organizing at 18 years old when she organized her co-workers at her first job to demand better working conditions. And through this experience, Zulema learned the importance of empowering marginalized communities so that they can develop their full potential and agency to advocate for their communities and workplace. And Zulema will be discussing the health status of California farm workers.
Thank you so much. Hi, everyone. Hopefully my internet's holding up. My name is Zulema Aleman, and I'm here with CAUSE, and I'll be sharing a little bit about the health status of California farm workers, why it matters, and what we can do. I'm trying to give you a lot of information in 15 minutes, so I'm going to give you little snippets of some highlights. You're free to contact me. I love geeking out about this. It's not only my work, but it's also my passion to improve farm workers' lives. So yeah, if you want to talk more about it, I'm super available for that. So today, like I said, I'm going to try to cover a lot of information. I'm going to talk a little bit about the UC Merced Farm Worker Health Study, our role in this study, some key findings, why it matters, and then some resources that are available to address the key findings locally. And then at the end, I have some resources and links for you all, which I'm happy to paste into that Google Sheet for y'all to access at a later time. So to start off with the Farm Worker Health Study and what it is. So the Farm Worker Health Study is a study that collected it was a 2-hour study that collected information from 1,242 farm workers in 6 languages across 5 California regions from 2021 to 2022. It was led by UC Merced and the California Department of Public Health, and they trained 26 farm worker serving organizations to collect this information from farm workers. Like I said, it was 2 hours long. And the goal, it had 3 goals. One is to measure all facets of farm worker life. So not just their health in terms of healthcare access or where their health was at, but also their home life, their work life, labor
Thank you, Sulema. So now we're going